Thank you for coming to our presentation. My name is Vion Zeta, and I am a fourth-year medical student at Georgetown University School of Medicine. I'll be discussing a respiratory protection program that my team developed in collaboration with the National Public Health Institute of Liberia. This program is designed for low-resource settings. It incorporates a sustainable approach to protecting healthcare workers from airborne diseases, elastomeric respirators. Building on extraordinary public health efforts to contain the Ebola virus disease epidemic, in 2018, the Liberian Ministry of Health released the National Infection Prevention and Control Guidelines to improve infection control nationally. The document addresses occupational safety and health concerns and lists the need for respiratory protection for some exposures, such as tuberculosis, but it's more focused on patient safety rather than on provider safety. For example, the word patient is used 9 times as often as the term healthcare provider. While 9 out of 41 appendices address hand hygiene, only 3 out of 41 address personal protective equipment. There is no information about respirator selection, fit, training, use, storage, and cleaning. Current efforts to address the COVID-19 pandemic in Liberia have been timely and effective in containing the national caseload. However, challenges to protecting healthcare workers remain, including supply shortages, power outages, and interrupted water supply in some locations. The Global Health Initiative at Georgetown began collaborating with the National Public Health Institute of Liberia in 2018 after gaps in occupational health were identified at a midwifery program. This respiratory protection program was designed for newly established isolation facilities in Liberia, where patients with highly infectious diseases such as COVID-19, Ebola virus disease, Lassa fever, and TB are treated. In partnership with the National Public Health Institute of Liberia, known as GHI-NPHIL, we adapted existing resources to create 6 modules for training healthcare workers on the use of elastomeric respirators, which provide superior protection to N95 respirators and are reusable. We utilized and adapted existing resources to create modules with accompanying learning objectives, handouts, and PowerPoints. They comprise infectious disease principles, respiratory protection, program development, medical clearance, fit testing, and respirator maintenance. Industrial hygiene experts extensively reviewed the products. Unfortunately, supply chain and transportation challenges have delayed on-site implementation and evaluation in isolation units as originally planned. This report describes the development of the training program. Here you can see what the videos and accompanying PowerPoints look like. The first module provides an overview of general infectious disease hazards to healthcare workers. The second describes personal protective equipment. The third lists components of a respiratory protection program. The fourth describes components of medical clearance for safely wearing a respirator. The fifth discusses how to conduct fit testing, and the sixth module describes how to clean, disinfect, store, and maintain respirators. Trainers have the option of using the videos or the PowerPoint slides, which can be modified as needed. The fourth, fifth, and sixth modules come with accompanying handouts that can also be used directly as checklists in the field. To our knowledge, there is no publicly available program that incorporates all of these training modules. The total watch time for all 6 videos is 56 minutes. However, they can be comfortably watched at faster speeds. I'm going to show you a few short clips of the videos to give you a sense of what they're like. Let's take a moment to review the difference between personal protective equipment, or PPE, and airborne and droplet exposures. Face masks are designed to prevent the user's droplets from reaching others. Because face masks are not fitted, airborne particles can enter through the sides. Fitted face piece respirators, like N95 and elastomeric respirators, provide a seal to the user's face to prevent the particles from being breathed in. Elastomeric respirators are also reusable. Besides completing medical clearance, they must be clean-shaven and avoid food and water for 30 minutes prior to fit testing. Workers should be fit tested wearing eye protection to ensure it doesn't interfere with the respirator's fit. Finally, healthcare workers will be asked whether they have any current symptoms associated with COVID-19 and have their temperature checked before fit testing. Again, particulate cartridge filters should be removed before the respirators are cleaned at the end of the shift. So, for our next steps, we aim to implement the program providing sample elastomeric respirators at the isolation units. We aim to evaluate the program using key informant interviews among frontline healthcare workers to identify best practices, barriers, and facilitators to program implementation. While we created this program with and for NPHIL, we have also created a more generalized version that can be adaptable for any low-resource setting. If you are interested in access to the training modules, or if you would like to collaborate with us to adapt and use the program in other low-resource settings, please feel free to email me or Dr. Sokas. We would like to acknowledge our other authors listed here. We'd like to thank the Georgetown Global Health Initiative for funding and NPHIL for their partnership. We are especially grateful to Dr. Stella Hines, Ronald Dobbin, and Philip Hagan for their invaluable input. Thank you for listening.